My mom and dad started Sta-home in 1976. Medicare, as the statute, was actually passed in 1965. It had been a project of President Kennedy's that ultimately President Johnson was able to fulfill. Mother had been a nurse at the University of Mississippi Hospital. She was a head OR nurse for many years. Then she went out ran a nursing home, and she saw a need. She saw that there were people in the hospital who didn't belong in the hospital. There were people in institutions who didn't necessarily belong there. Our philosophy, what we do, is to provide that level of care that the patient needs to help them avoid having to go to the hospital, help them avoid that crisis, that exacerbation of whatever it is that's going on with them. That's what Home Health's about.
We're all about being a high-performing organization in order to support our patients as best we can. And to do that, we want to make sure that our employees are competent to do the work and that they are embracing the values and the principles that Sta-home possesses.
Sta-home has like 32 branches across 46 counties in the state. And each of these branches have got, anywhere from 30 to as many as 70 people. The people in those branches get close to one another. They really operate as, their own little family, their own little support system. It's remarkable how many people that we have who've been here for 15, 20 years.
My tenure at Sta-home is the longest of any previous employer. The thing about Sta-home is the family atmosphere, the open door policy, even with the CEO. There's no corporate office in a Denver, Colorado that you have to go through. If we need an answer, we can get it today.
I know that Sta-home cares about their patients. I know that I am cared about with Sta-home. It is a family atmosphere. We really work together to make sure that we're meeting the needs of the patients. We're meeting the needs of each other also. I know that to be true.
All home health agencies provide the same services, and we're all bound by the same regulations. However, it's the work environment and the people and the foundation that this organization has that makes it different, that sets us apart.
Biggest competitors are the publicly held guys. They're right here in our backyard. And the closest one to us, I think we have almost double their market share. And there's a reason for that. We run Sta-home as a family business. People talk about us and think about us as a family business, and we demonstrate family values.
Going to national meetings gives us a real good perspective just by listening to others in the audience and the questions they ask, and they're asking questions about doing things that we've already done. So it gives you a real good idea of where we are, not only in the state, but I believe in the nation. It's just a good company.
I never feel like the dollar sign is at the forefront of what we're asked to do. We are here providing home care. We have to make money to stay afloat. However, the patient comes first. I've always felt that. I've never questioned that with Sta-home. I've been told do what's best for the patient.
I can tell you what Vic Carasi told me when I came in the door. And he basically said, if you can be good to Sta-home, Sta-home will be good to you. And what that said to me was, if I'm good to the agency by taking care of the patient, then they're going to be good to me.
Healthcare reform has created an enormous opportunity for the delivery of home health care. And the demographics are such that growth is unavoidable. Home health industry will have to grow to meet the demographic demands of baby boomers who are entering the Medicare system now. So this industry, with the right people like Sta-home, is very secure for a long-term future.